right, so everybody please lie on your backs. And we start our lessons with just feeling how we're connecting with the floor. It's like taking a snapshot of where am I right now in this moment, and then it gives you something to compare it to when we're finished with the lesson. And how we do that is we begin to feel how your body is relating to the floor, how you're receiving support, and how you might be holding yourself up away from the floor. So maybe not able to fully let go and relax into the support of the floor. And usually where we're not able to relax is our habitual ways of holding ourselves and sitting and standing continue in lying down. And although we can consciously know it's not necessary for them to continue lying down, our brain has practiced this for so long because it believes that this is the best way to protect us and keep us safe. So in the movements, we just gently introduce the idea to the brain that maybe it's working harder than it needs to. So lying there, feel the back of your right and left shoulder blades and see if you can feel any difference between the pressure between the right and left shoulder blades, the amount of contact. Bring your attention to each of your arms, your right and left arm. Again, does one feel a little lighter or heavier? You might notice that one feels a little longer or shorter. One might be just positioned a little closer or farther away from your body. Feel the back of your ribs on the right side and the left side. They may be in contact with the floor, or because of the way your low back curves away from the floor, they might not be in contact with the floor. Just get a sense. Again, see if you feel any differences from the right and left sides. And it's not a requirement to feel a difference from the right and left sides, especially when you're new. That might be very difficult or challenging. Usually, the more you learn to distinguish subtle differences, the more you get in touch with your own kinesthetic sense, the easier and more natural it is to feel your very normal asymmetries. Sometimes in the beginning, noticing your asymmetries can be somewhat bothersome or disturbing because our medical system has imprinted on our brains that we should be symmetrical. Or maybe it's just the physical therapists that have imprinted this on our brains. And then scan with your attention behind your hips and buttocks. Again, feeling the weight behind the right buttock and the left buttock. The contact. And feeling each of your legs. Does one feel a little lighter or heavier? Feel the weight behind your heels. And I'm noticing in this class that you are all lying with your legs long, which is wonderful as long as it's comfortable. So something that I did not mention earlier is if there is a position that we are in that is not comfortable, kind of along the lines of if it hurts, don't do it, modify it as needed so we can decrease the static of pain or discomfort to your brain. So bending your knees is perfectly acceptable. And so why don't we have everybody bend their knees one at a time now, please. So your feet are flat on the floor. And just take a few moments and play around with the first position where your feet landed. Just sort of questioning, is this first position the best position? Does it really give your pelvis and your low back the best kind of support? Notice how you're breathing. Feel the space behind your lower back. Just have a sense of how much your lower back curves away from the floor with your knees bent. And then take a moment to lengthen each of your legs one at a time. See if you can feel how that changes for some of you, the space behind your lower back. And when you have a sense of that with your legs long, then again, one at a time, bend your knees. And with your knees bent, feet standing, just notice how you're breathing. And place your right hand on your upper chest, please. So at this point, knees are bent, feet are in a standing position. And with your right hand on your upper chest, just feel the breath. Feel the influence of the inhalation and the exhalation on your chest. And for some of you, you may feel a gentle rising and lowering of your sternum, your breastbone, your ribs. Just gently begin to slide your right hand towards the left shoulder. Just sliding it to the left shoulder and then back to the middle. And do this several times. Just a light reaching and exploring. What does it feel like to have your own hand on your chest, touching your skin? Do you feel below the skin into the ribs? Do you sense below the ribs into the pulsing of your heart? And is your attention on the sensation of your chest and your ribs and your shoulder? Or is there any attention to the sensation under your fingertips? So continuing to reach leftward to your shoulder. Go ahead and continue up a little bit to your neck. Then maybe come back down in a resting position. And then next time you reach to your shoulder, the left side of your neck, you can come up along your face a little bit. And lower back down. So just continue this exploration leftward. Letting your right hand explore as much of the upper left side of your body, your face, your head. And notice how you're breathing as you start to explore and try this very strange and new movement. Do you hold your breath? I find it fascinating to discover how often we hold our breaths during these simple movements. And we begin to awaken to how often we hold our breath when we're out doing our life in the world. And notice what your eyes do. Are your eyes following your hand? Each time your hand goes leftward, your eyes follow it, and just let them follow where your hand goes. Every once in a while, bring your hand and arm back to resting in neutral. Good. And then bring your right hand back to rest at your side. And just after this first very simple movement, feel how your right arm is resting on your mat and your left arm. Is there any changes in the sensation of weight, of support, length? And also sense the left side of your chest compared to the right side. The left and right sides of your face. Feel your breath with the gentle raising and lowering of your ribs, and notice if there's any difference that you're able to detect between how the ribs raise and lower on each side. And then bring your right hand back to your upper chest, along your breastbone. And take your hand leftward to your shoulder as if you were almost going to try to reach down your left arm. And back again. And do this several times. Each time you're taking your arm leftward, take your eyes rightward. And then a couple times let your eyes follow your hand leftward. Notice how you're breathing. And then a couple more times, see if as you take your hand leftward and your eyes leftward, are you able to turn your head a little bit rightward? It's getting a little trickier. Hand and eyes left. Head just a little bit to the right while breathing. That's the tricky part. Good. And then pause in the middle, let your arm down. If it's comfortable, let your legs down for a minute. And you'll hear me say this probably frequently, but we're obviously not resting in these awareness through movement lessons because of fatigue, but we're resting the brain because for most of us we are not used to attending to ourselves, our movements, our sensations with this kind of detail, with this kind of sensitivity, and with this kind of movement that it's easy for the mind to try to tell you you're not really doing anything because you're burning very few calories and supposedly not stretching any muscles, although recent studies might suggest otherwise. So once again, please bend both of your knees so your feet are standing. And just check out the position of your feet. Sort of assuming that the first place your feet land may not be the best. They might be habitual. They might be where your mind would put them 100 times over and over again if nobody were to question it. But as you really listen to the sensations of your body, you might find that there's another place that really provides more support and relaxation for the rest of your system. And lying here, gently begin to press through your right foot. So you're just going to push your right foot into the floor and release it. Several times, pushing and releasing. And feel the connection into the right hip. As your right foot presses, what does your right hip want to do? It's like there's an invitation. And for most of us initially, our right hip just doesn't move because we don't think along the connective lines of the skeleton. But see if you can feel the invitation for the right hip to begin to lift up off the floor just a little. Each time you press your foot down and then you release it and your hip comes back down. And you might also notice as you press through the right foot, the right hip lifts a little bit, that creates a rotation. Your pelvis begins to turn a little bit leftward. You were to track your belly button. You're pressing through the right foot, but the belly button is going leftward. See if you can get a sense of that possibility for yourself. Good, and then just pause for a moment, keeping your knees bent. And bring your left arm out to the side, so it's at about a 90-degree angle from your trunk. So straight out from the shoulder. Good. And again, if this isn't comfortable, what do? You change the position. You might bring your arm down a little lower. If you need to, you could bend your elbow. If you have access at home to extra towels or pillows, it's something, reasonably in that direction. And bring your right hand to your chest and begin the movement again, so right hand to the chest, of reaching across, sliding the palm of your hand across your chest to your left elbow, and beginning to play with the idea of how am I going to reach my right arm down on my left arm. And what's wonderful about Feldenkrais movements is we don't want you to get there the first time. We really want you to explore your way there. How do you reach across? How do you use your right shoulder? If you were going to push yourself and force yourself one way or another to be able to reach down your left arm, what would you be pushing through? Where is that initial resistance? Do you hold your breath? Do you feel a tightness in your shoulder? Maybe you feel it in your chest or your ribs. Notice what your head is doing. Does your head stay looking at the ceiling? And if you soften your neck consciously, can you let your head roll and follow your arm leftward? And notice how you're breathing. And some of you are already discovering this. But for those of you who might not yet, can you feel that one foot wants to begin to press into the floor to help a little bit? And if you don't feel it, just play with it. I wonder which foot it is. Would it be my right foot or my left foot? Am I clenching my teeth? How smooth and free is your breath with each movement? And if you haven't quite discovered it yet, let yourself press through your right foot. When you reach the comfortable limit of your right hand going down your left arm, then begin to press a little bit with your right foot and see if that, along with lifting the right side of your pelvis, help support this movement in some way. Once you've tried it a few times, pressing through your right foot, just for fun, what happens if you press through your left foot? And notice what your internal commentary is about that. Reaching with your right arm, down your left arm, but pressing through your left foot. So some of your internal commentary might be, what? Is that teacher crazy? Or you might think, that's impossible. Or you might think, I'm not getting this, I must be stupid. We all have ways that we talk to ourselves about moving, performing, learning. And one of the designs of these lessons is so that you can bring enough consciousness to the movement that you're also bringing consciousness to your own self-talk. And when you've tried it a few times, pushing through your left foot, again, just finish with one or two more pressing through your right foot. Right hand on the chest, sliding leftward down the left shoulder and the left arm. And then resting and lying on your backs. And sensing once again what resting on the floor is like now. Is your body's relationship to the floor changing? And if it is, why? Is it just that you've spent 20 or so minutes resting? If you were just resting and not moving, would changes have begun to occur? Are the changes different on the right side than the left side? So how many of you, just kind of raise your hand, keep your eyes closed so nobody's embarrassed. How many of you are feeling more differences from your right and left side now compared to the beginning of the lesson? Okay, so we've got about 50%. So for those of you who aren't, you have good company. There's nothing wrong with that. And now I just realized I was going to have you all lie on your sides, but not everybody has pillows. So, okay, so rolling onto your left side, getting some support for your head, and bend your hips and knees so that your right leg is resting on your left leg, and the angle at both your hips and your knees is about 90-90. So your legs are kind of in the same position they'd be in if you were sitting on a chair, but you just sort of tipped off it onto your side. Good. And then just see if you can slide your right leg forward and back on your left leg. There'll be a little friction of your pants or your skin, but your knee is actually going to lengthen forward towards the wall that you're facing. And let your foot and ankle pretty much stay on top of each other. So you don't need to move your lower leg so much as your thigh is just sliding forward. As it's almost like your top thigh is getting longer on your lower thigh. which also means that your pelvis is just rolling forward towards the floor. Okay, excellent. So just feel that rotation, sliding the leg forward and the pelvis is going forward and back. And think back to the movement that we did when you were pressing your right foot through the floor. Your pelvis was lifting and it was turning a little bit leftward. So see if you can make that connection between the similarity of this movement and that movement. And just let your ribs and your spine be soft so everything's following and rolling a little bit forward and back. Good. And then pause in the middle. And see if you can straighten out or lengthen your lower leg, so that would be your right leg, so that it's behind the right leg. So let's see, I'm confused. You're going to lengthen your left leg and let your right leg stay bent in front of your left leg. And again, if you need a pillow or a towel, I can bring one over to you for this part. Okay, and as with all of these lessons, this does create a little twist in the pelvis and the low back. So really listen for, is this okay with you? Is this okay with your back, with your pelvis, with your hips? And if it's not, what do? You change your position, you find a way to make it comfortable, you get a pillow, or you just keep yourself in the same position we were in before, where your top leg is supported by your bottom leg. So there are rarely any hard and fast rules in Feldenkrais lessons, except that it's important that you learn to listen and take care of yourself and your body and your body's needs. So for most of you who have your right leg bent in front of your left leg, which is long, behind your right leg, now try sliding that right leg forward and backward in this position. Again, there might be a little friction on the floor, but just see how that movement is for your hip and your pelvis. Feel what happens up your spine. Great, so it's the same idea. You're just lengthening your knee as if you're reaching it towards the wall that you're facing. Just sliding it forward and back. Feeling how nice is that for your back, for your ribs? Is your neck responding in any way? Excellent. And then just pause for a moment. Breathe. Bring your right hand out in front of you. And if you're able to, I know some of you are using your left arm to support your head and neck. If you're able to let your right hand rest on the palm of your left hand, then do so. But if you really need your left arm to support your head, then just place your right arm long out in front of you on the floor. And can you slide both your hand and your knee forward and back? So for some of you, you'll find yourself practically rolling onto your front. And for others, you'll certainly be aware that you're rolling a bit in that direction. And again, always listening. Your job is to take care of you, in spite of what you may have learned all these years. Notice how you're breathing. And then let's just play for a moment and see if you can slide your hand backwards while you slide your knee forwards. Imagining those little kids, those infants and toddlers, just wiggling on the floor, doing everything they can to figure out what rolling might be, even though they don't even know that's what they're figuring out. It's just the impulse towards life, wiggling and playing and feeling movement in their wonderful bodies. Nice, nice. And then find a way to lightly roll onto your backs again, please. And just feel. Feel the whole right side of your body resting here, and the left side of your body. The support of the floor. Behind the right and left shoulder blades. Behind the right and left buttocks. Each of the arms and legs. And then bend each of your knees up again, please. Feet flat on the floor. Left arm out to your side. Right hand placing on your chest. First, just feeling for life. Feeling your breath. Feeling your ribs. Your sternum. And then when you're ready, just gently exploring your way towards your left shoulder. And you might come back to the middle before reaching down your left arm. Just beginning to feel if anything has changed. How does this exploration feel now compared to the beginning of the lesson? What's it like for your left hand to find your shoulder and arm more and more easily? To feel which parts of your body is just spontaneously responding and supporting the movement. Does your right foot naturally begin to press and help, or had it not occurred to you until I just mentioned it? All of which are perfectly acceptable options in the process of learning. And the next time you come back to neutral, open your right arm out to your right side. Fold your left arm so that your left hand is on your chest. And without doing anything, just imagine. Imagine what it's going to feel like to slide your left hand across your chest towards your shoulder. Imagine what you're going to feel in your ribs, in your neck. In your imagination, does your head begin to follow? Do your eyes follow? Does anything happen below your left foot? Does your pelvis roll? Just imagine as many components as possible. And for some of us, imagination of the kinesthetic senses comes very easily. And for many of us, it does not come easily. And one thing I have experienced over many, many years is it comes more and more easily Although these were often the parts of the lessons in my early years that annoyed the heck out of me, because my imagination skills were not grand. But when you can't stand it anymore, begin to actually do the exploration and see how much of what you're actually doing in sliding your left hand across your chest towards your right shoulder matches what you imagined, and which parts of the sensations of movement did you leave out of your imagination. And you don't need to get all the way down your right arm to start, but just exploring your way there. How do we get there? Is there an invitation for your left foot to press into the floor? You might play a few times with what it would be like to let your right foot press into the floor. It obviously changes things dramatically if you press with your right foot. And you can notice, is this okay with you? What it feels like to press with your right foot. Is it somehow incongruent, or worse yet, wrong? Or is it interesting? Like, how weird is that? And then next time you're pressing with your left foot and sliding your left arm down your right arm, what would it be like to turn your head to the left without stretching, straining, or paining? Can you do that and still breathe smoothly, easily? And then let yourself pause in the middle. Roll on to your right sides, please. And again, if you have a pillow or a head support, now would be the time to use it. If you need to use your right arm. For some reason, lying on your right side doesn't work or isn't comfortable, then just imagine from what you learned on the other side. And imagine what we did on the other side. What's it like to imagine sliding your left knee forward and back on your right leg? What's that like to imagine feeling? Do you, even in your imagination, do you feel the little bit of friction between your clothes or your skin? In your imagination, do you sense your pelvis rolling a little forward and back? And then lengthen your right leg behind your left leg so that your left leg is resting on the floor in front of you and your right leg is lengthened behind your left leg. And then imagine the movements from here. Left leg sliding forward. You could even include the imagination of your left arm sliding forward with it. What's it like to imagine your left knee going forward and your left arm going backwards? And then when you're ready, play with any of the movements that you want to try. Play with just the knee going forward. Explore the knee and the arm sliding forward and backwards together. Notice how you're breathing. What's it like if you take your arm and your knee in opposite directions? And if you're listening to the CD, then I would encourage you to press pause and play with this a little longer. But for our class, I'm going to have you just roll back onto your backs, please. Just feeling. By now, for some people, for many people, we're not used to paying attention to our bodies for this long, let alone are we used to lying on the floor for this long. So sometimes we can get a little tired. Sometimes the pain starts speaking to us. Sometimes our mind wants to tell us that we're bored. Just notice. And then one last time, please bend your knees so your feet are standing on the floor. Put your left hand on your upper chest, your right arm out to the side. Begin sliding your left hand down towards your right shoulder, down your right arm. And as you slide back, unfold your left arm out to the side and fold your right arm so that your right hand comes to your chest and begins to slide down your left arm. And just experience rolling a little bit side to side this way. Unfolding and folding, alternating the support under each foot. Breathing. Noticing which parts are light and easy and where do you still find a little bit of effort and strain. And then just coming to your backs one last time, taking a full rest. Feeling behind your right and left shoulder blades, the support each of your arms receives. Is there more weight or less weight? More contact or less contact? Sense of feeling more supported or less supported. And notice the behind the right and left buttock, the support on the floor and each of the legs. Feel the breath in your belly and your chest. And then stay with your sensations as you take your time and slowly roll to your side. You can use your new form of rolling or one of your old forms of rolling. Continuing to take your time to come up to standing. And when you turn off the CD, take plenty of time to begin to walk around and really feel what sensations might be new or different, pleasant. You might notice if you begin looking for the pain, and can you shift your attention to feel for the new sensations. And then take yourselves for a little walk. And have a wonderful day.